Hi everyone, welcome to our YouTube channel pharmaforge, and today we are going to discuss the topic that is drug use in treatment of gout. Uh, Gout is a metabolic disorder that is associated with metabolism of the purine, and gout is characterized by the joint pain, swelling, inflammation in the joint, and actually gout occur due to the condition of the hyperuricemia. Hyperuricemia means increase in the level of the uric acid in the blood. Um you can see in the slide that under normal condition, purine undergo metabolism, and purine firstly converted into the hypoxanthine, and that hypoxanthine converted into the xanthine, and xanthine finally converted into the uric acid in the body. So final product by the metabolism of the purine is uric acid in our body. But under certain condition, metabolism of the purine increases in our body beyond specific limit, means it occur in excess. So because of that, level of uric acid also increases in our blood in excess, and that uric acid cannot be excreted easily from the body because uric acid is less water soluble. So the formation of the crystals of the urate occur. Urate crystal formation occur, and these urate crystals they get accumulate inside the joints, inside the synovial fluid in the joint, and it lead to the some deformities in bones, then joint pain, inflammation, swelling, redness. So this is one of the disorder that is associated with increase in level of uric acid in our body. uh, मीन्स गाउट एक ऐसी कंडीशन है कि जिसमें यूरिक एसिड का लेवल हमारे बॉडी में बढ़ता है, और प्यूरिन का मेटाबॉलिज्म बहुत हाई लेवल में होने की वजह से वो यूरिक एसिड भी बहुत एक्सेस अमाउंट में बनता है, और वो यूरिक एसिड एक्सक्रीट आउट नहीं हो सकता इजीली बॉडी से, क्योंकि यूरिन में वो सोल्यूबल नहीं होता है, तो वो डिपॉजिट होने लगता है जॉइंट्स में, वो यूरिक एसिड डिपॉजिट होने लगता है इन द फॉर्म ऑफ क्रिस्टल्स, एंड उसके वजह से जॉइंट पेन होता है, इन्फ्लामेशन होता है, और उसी कंडीशन को हम गाउट बोलते हैं. तो गाउट की वजह से पेन होता है, तो पेन का ट्रीटमेंट करने के लिए फर्स्टली हम प्रेफर करते हैं नॉन स्टेरॉयडल एंटी इन्फ्लामेटरी ड्रग, बिकॉज फर्स्टली पेन को ट्रीट करना है, तो उसके लिए नॉन स्टेरॉयडल एंटी इन्फ्लामेटरी ड्रग प्रेफर किए जाते हैं. और बाद में यूरिक एसिड का लेवल मेंटेन करने के लिए अलग अलग ड्रग दी जाती है. सो उसके अकॉर्डिंग classification of the drug that are used to treat the gout is given in this slide. That drug used for the acute gout treatment, and drug used for the chronic gout treatment. uh, Acute gout means the condition is not much more severe, so for that firstly non-steroidal anti-inflammatory drug, then colchicine and glucocorticoids. These drugs are given in case of the acute gout. And for chronic gout, to maintain the level of the uric acid in the blood, firstly uric acid synthesis inhibitor drug, in that allopurinol and febuxostat and urocosuric agent. Urocosuric agent means those drug that increases the excretion of the uric acid. It include probenecid, then sulfenpyrazone, and third is a drug that increase the metabolism of the uric acid. Means those drug that increase the metabolism of the uric acid, so it can be excreted easily from the body. The example is pegloticase and rasburicase. So this classification part is important, especially synthesis inhibitor, that is allopurinol and febuxostat. Then uricosuric agent means those drug that increases the excretion of the uric acid, that is probenecid and sulfenpyrazone. And third is a drug that increase the metabolism of the uric acid, that is pegloticase and rasburicase. So in this, the first is a non-steroidal anti-inflammatory drug. So in this naproxen, peroxicam, diclofenac, endomethacin, these drugs are used. Aspirin is used in the treatment of the gout because aspirin uh, itself causes hyperuricemia, so it is contraindicated in the treatment of the gout. Second is a colchicine. Colchicine is a alkaloid category drug obtained from the Colchicum autumnale, and this drug is used in the treatment of cancer also, because it causes metaphase arrest. Along with this, it is used in treatment of gout because it decreases the migration of the granulocyte at site of inflammation. And colchicine inhibitor release of the leukotriene. Leukotriene is a inflammatory mediator, so it control the release of the this inflammatory mediator and show its action in treatment of gout. It is more effective than non-steroidal anti-inflammatory drug. And third is a corticosteroids. Corticosteroids used in treatment of gout because of their anti-inflammatory activity. They are given intra-articular route. Intra-articular route means inside the joints, not intra-arterial. It is intra-articular. Articular means inside the joints. Then intra-articular injection of the soluble steroid is effective to treat the gout. Corticosteroid mostly preferred in those patients in which non-steroidal anti-inflammatory drug cannot be tolerated due to its side effect of peptic ulcer, or in patient of renal failure. Uh, and in case of the chronic gout, in case of chronic gout, as we discussed, firstly synthesis inhibitor or drug that increase the metabolism of the uric acid, or third category, that drug that increase the excretion of the uric acid. These three category drug are used. So in first, that is synthesis inhibitor, allopurinol and febuxostat. These two are major drug in this class, that is allopurinol and febuxostat. So allopurinol, this drug is a purine analog drug. And what is mechanism of action of this allopurinol? Allopurinol inhibitors xanthine oxidase enzyme. uh, as you can see in this slide, uh, allopurinol play a role when there is a conversion of the purine to hypoxanthine and conversion of hypoxanthine to xanthine. All these steps, it occur in the presence of xanthine oxidase. It occur in the presence of xanthine oxidase. So when xanthine oxidase, that enzyme, is inhibited, automatically uric acid formation is inhibited, and only formation of hypoxanthine and xanthine, these two metabolites remain, which are comparatively more water soluble than uric acid. So uric acid formation is inhibited by this drug, that is allopurinol, and it is competitive inhibitor of the xanthine oxidase enzyme. And allopurinol, it is used in treatment of kala azar also. And alloxanthine is its metabolite, which is non-competitive inhibitor of the xanthine oxidase enzyme. So this is about the allopurinol. Then second drug is a febuxostat. Febuxostat is used in the treatment when there is a intolerance with allopurinol, and this drug is hepatotoxic drug. Mostly allopurinol is used. Then second is a uricosuric agent, means those drugs that increase the excretion of the uric acid from the body. So in this, first is a probenecid. Probenecid is famous for its interaction, drug-drug interaction with penicillin. Means when it is given with penicillin, it decreases the tubular secretion of the penicillin. Means excretion of the penicillin occur through the tubular secretion, and this process is inhibited by the probenecid. So a duration of action of the penicillin increases because of the probenecid. Probenecid is a uricosuric agent, means it increases the excretion of the uh, or renal clearance of the uric acid, means renal clearance of the uric acid, it is increased by the probenecid. Then second drug interaction of probenecid is probenecid also block the tubular secretion of methotrexate, cephalosporin, endomethacin, and that's why their duration of action is prolonged. And second drug from the uricosuric agent class is a sulfenpyrazone. This drug not much more used in developed countries because it causes the renal toxicity. uh, and third class of drug is drug that increases the metabolism of the uric acid. Two names are there, pegloticase and rasburicase. Pegloticase and rasburicase, these two drug causes increase in the metabolism of the uric acid. These both are product of the recombinant DNA technology. And pegloticase, it is recombinant protein like uricase, and it is given by the intravenous route. And rasburicase, it is a recombinant version of the urate oxidase. Actually urate oxidase, it is involved in the metabolism of the uric acid, so it can be excreted easily, but this urate oxidase, it is absent in humans, so that's why it's a recombinant version is given to the patient, that is rasburicase. So in this topic, classification of the drug is important, means क्लासिफिकेशन को याद रखने के लिए हमें इतनी चीज़ याद में रखनी है कि इस गाउट में फर्स्टली तो पेशेंट को पेन होता है, और पेन के लिए हम उसको नॉन स्टेरॉयडल एंटी इन्फ्लामेटरी ड्रग्स देते हैं, और इन्फ्लामेशन होता है तो इन्फ्लामेशन ट्रीट करने के लिए हम कॉर्टिकोस्टेरॉइड्स देते हैं। और जो पेन की वजह क्या है, तो पेन की वजह है इंक्रीज इन द लेवल ऑफ द यूरिक एसिड। तो उस यूरिक एसिड का लेवल बॉडी में कम करना है, तो पहले तो उसका सिंथेसिस घटाना होगा। अगर सिंथेसिस हुआ है तो जो कुछ भी यूरिक एसिड सिंथेसाइज हुआ है वो एक्सक्रीट आउट करना पड़ेगा, और अदरवाइज यूरिक एसिड का मेटाबॉलिज्म बढ़ाना होगा। ये 3 टारगेट्स है हमारे ट्रीटमेंट के, एंड उसका इंटेंशन रख के हमें ट्रीटमेंट करना है। तो उसका इंटेंशन रख के जो हम ट्रीटमेंट कर रहे हैं, तो उसमें सिंथेसिस इनहिबिटर आ रहा है एलोप्यूरिनॉल एंड फिब्यूक्सोस्टैट। यूरोकोश्यूरिक एजेंट मीन्स दोज ड्रग दैट इंक्रीज द एक्सक्रीशन ऑफ द यूरिक एसिड, that is probenecid and sulfenpyrazone. And third class is a drug that increase the metabolism of the uric acid, that is pegloticase and rasburicase. Classification is important in this part. Once you cleared with part of classification and mechanism of action, it becomes simple to understand the topic. First, that is a drug used in treatment of acute gout, that is non-steroidal anti-inflammatory drug, naproxen, paroxicam, diclofenac, endomethacin. Second is a colchicine, and third is a corticosteroids. And in case of the treatment of the chronic gout, in synthesis inhibitor allopurinol and fibuxostat, and allopurinol which inhibit the xanthine oxidase enzyme, or fibuxostat, both allopurinol and fibuxostat, they inhibit the xanthine oxidase enzyme competitively and inhibit the synthesis of the uric acid. And uricosuric agent, in that probenecid and sulfenpyrazone, this drug increase the renal clearance of the uric acid. And third is a drug that increase the metabolism of the uric acid, pegloticase and rasburicase. So thank you.